It is a great honor to give you this presentation at this time in the history of Canada's healthcare system. I want to apologize from the outset that you're going to be listening to my disembodied voice over a set of PowerPoint slides, but that's probably the best way to convey the information I have in the roughly 20 minutes this talk will take. It's always a great idea to start at the beginning, and for this subject, a reasonable beginning is the 1948 Universal Declaration of Human Rights. This, among other things, declared that health is a fundamental human right. And in the years that followed the declaration, Canada played a key role in helping the United Nations to translate the Statement of Human Rights into agreed-upon obligations of governments worldwide. This specifically included an obligation for governments to provide universal access to necessary health care, and critically for this talk, it also included an obligation to provide universal access to necessary medicines. Consistent with these rights and obligations, every high-income country with a universal healthcare system provides universal coverage of prescription drugs. Every such country, with the exception of Canada, that is. Canadian Medicare is unique insofar as our system of universal public health insurance ends as soon as a patient is handed a prescription to fill. Whereas virtually all of the costs of medical and hospital care in Canada are covered under our Medicare system, only 43% of prescription drug expenditures in this country are financed by public drug plans. That was not supposed to happen. Virtually every major commission on our healthcare system, dating all the way back to the 1930s, has recommended that the federal and provincial governments collaborate to create a universal, comprehensive public health insurance system for all Canadians. And every such inquiry has recommended that the coverage of prescription drugs be part of that system. The most famous of these commissions was Justice Emmett Hall's Royal Commission on Health Services from 1961 to 64. Justice Hall specifically argued that a system of universal public coverage for medicines on an evidence-based national formulary should be added to the Canadian Medicare system just as soon as universal public coverage of medical care was in place. He called this next essential stage of Canadian Medicare Pharmacare. And here we are today, more than a half a century later, still waiting for that Pharmacare program. Provinces have not done nothing in all of these years. Indeed, today there are more than 100 different public drug plans in Canada. Yes, that's right. Our federal and provincial governments run more than 100 different public drug plans. These are akin to tiny umbrellas that were erected at various points in time over the past 60 years to provide public coverage for very specific segments of the population. Access to these public umbrellas, if you will, varies depending on your age, income, disease, or province of residence. No province offers universal comprehensive public drug coverage akin to the coverage that Canadian Medicare offers for medical and hospital services. Indeed, not one province even funds as much as half of all of the prescription drug costs that patients incur within its jurisdiction. Thus, our system relies very heavily on private financing of medicines. About 2/3 of Canadian workers have drug insurance plans. Like the myriad of public plans in Canada, these private drug plans are also akin to tiny umbrellas, only they are for even smaller, more exclusively defined groups. There are literally thousands of different private drug plans in Canada. Each is negotiated and paid for independently by different employment groups. Even the same employer may have multiple independent private drug plans for different groups of employees. You see, contrary to the international declarations that access to medicines is a human right, we treat prescription drug coverage in Canada as if it was a privilege. Now, I believe Canadians are justifiably proud of the principles that underpin our Medicare system, a system that is designed to provide all of us with equitable access to high-quality health care on the basis of need, not on the basis of where in the country you live or how much you can afford to pay. But if Medicare is a source of national pride in Canada, our lack of universal pharmacare should be a source of national embarrassment. Now, I know that's a strong statement, especially given that it isn't actually causing that much embarrassment for that many Canadians at this moment in time. But I think the evidence concerning Canada's performance on key pharmaceutical policy outcomes will convince you that our system is, in fact, an embarrassment in comparison to universal, comprehensive public pharmacare systems abroad. I want to show you some data on these key outcomes of interest in pharmaceutical policy. We will look at access to medicines because that is arguably the single most important goal of any pharmacare system. We will also look at the total cost of a pharmacare system, in part because any system that is to provide universal access to necessary medicines must be sustainable. Finally, we will look at the financial equity and financial risk dimension of a pharmacare system. This is because different systems of prescription drug coverage will place different amounts of strain on individual households and even on individual businesses. Now, you may notice that appropriateness is not listed here. That's not because I don't care about appropriateness. The appropriateness of medicine use is a critically important goal for a pharmacare system, and it should be a central pillar of a national pharmacare system for Canada. The problem for this talk is that it is very difficult to measure and compare appropriateness of medicine use across countries. We should not lose sight of it when planning national pharmacare, but I cannot provide you with quality comparable data about appropriateness today. I can, however, provide you with some data on what might be considered a secondary objective of pharmaceutical policies. While the goals of promoting universal access to appropriately prescribed, affordably priced, and equitably financed prescription drugs are unquestionably central to a pharmacare system, many countries are also interested in economic development that might stem from pharmaceutical industry investments. I will therefore also provide data on how Canada performs in terms of industry investment in this country versus those countries with universal pharmacare programs. Now, here is the list of countries that we will look at in this talk. All of the comparator countries, which will be in blue in all of my graphs, have more or less universal single-payer public healthcare systems. Of course, their systems differ in various ways, but they are all primarily publicly financed at a population level, which makes them reasonably comparable to Canadian Medicare. All of these comparator countries provide universal prescription drug coverage for people of all ages and all incomes through the same system of financing they use for medically necessary healthcare more generally. And patients face little or no charges to fill prescriptions in these countries. The one exception is Australia, where working-age people pay a co-payment for prescriptions that is equal to about 35 Canadian dollars. In the rest of these countries, if a medicine is on the formulary for coverage, it's virtually free to the patient. Now, if Canada implements a universal public pharmacare system, the hope is that it would be very much like the ones in these comparator countries, although ideally without the co-payments found in Australia. Now, you will see that I've included Quebec as a comparator here, and that's because corporations in the pharmaceutical industry and insurance industry want Canada to adopt Quebec's model of so-called universal drug coverage. In Quebec, people are required by law to purchase private drug coverage through their workplaces, but the cost of that coverage is unregulated. If they don't qualify for work-related coverage, they must purchase coverage from the province. I have studied the Quebec system a number of times over the years, and I have concluded that it is not the right system for Canada. I think that will become clear as we review the evidence on how it compares both against Canada and against other countries with truly universal public pharmacare programs. Now let's dive into the data. I'm going to show several slides that use the same general format. Each slide shows comparable data for each country and a dotted line representing the average for the 5 countries with universal pharmacare systems. So this slide concerns access to medicines. The figure shows the percentage of adults in each country that reported that they skipped at least one prescription in 2016 simply because they couldn't afford the out-of-pocket cost. The data shows what you'd expect. Patients do not frequently report difficulties affording prescriptions in countries with universal pharmacare systems involving little or no charges for prescriptions filled. In Canada, 1 in 10 adults reports skipping prescriptions simply because of cost. You will note that Quebec does only slightly better than the Canadian average, and that is because Quebec's system was designed with the insurance industry in mind. It includes patient-paid premiums, co-payments, and co-insurance, all of which can be a significant barrier to access. Now, to put the international comparators in perspective, if Canada were to achieve the average rate of access to medicines found in these comparator countries, 2 million Canadians would be filling prescriptions that they are currently foregoing. That has got to have an impact on health. Indeed, evidence from Canada and abroad indicates that the financial barriers to prescriptions that Canadians face have a very real impact on patient health. It is estimated that in 2016 alone, 374,000 Canadians used additional medical and hospital services because they skipped prescriptions owing to out-of-pocket costs. More tragically, it is also estimated that more than 300 Canadians die prematurely every single year because of cost-related barriers to basic preventative prescription drug treatments, barriers that would not exist if our pharmacare system was universal and comprehensive like those in these comparator countries on this chart. So if you think about it, barriers to accessing medicines in Canada are causing the equivalent of an airplane full of Canadians crashing to the ground every single year. Unfortunately, because these are statistical deaths, not bodies strewn across a mountainside, policymakers can and do play the political game of pretending there isn't a problem. But there is, it is real, and it is avoidable. And what is particularly frustrating about our lack of action on this problem is the fact that universal public pharmacare systems do not only save lives, they save money. This slide shows the total amount each country spends on prescription drugs per person in the population. It includes private and public payments for medicines used outside of hospitals in these healthcare systems. The first thing that jumps out from this slide is the fact that Canada spends more on medicines than any comparable country with universal pharmacare. Canada spends almost $900 per capita on prescription medicines outside of our hospitals. Quebec spends over $1,000. In contrast, countries with universal, comprehensive public pharmacare systems spent an average of $444 per capita on prescription drugs during 2018. Let me put these numbers in perspective. If Canada was to adopt Quebec's system of prescription drug coverage, we would not dramatically improve access to medicines, but we would be spending nearly $5 billion more than we are currently spending on medicines. That is precisely why the pharmaceutical and insurance industries are keen on Canada adopting Quebec's model of so-called universal coverage. In stark contrast, if we were to adopt a universal single-payer pharmacare system like those in these other comparator countries, we would see a dramatic improvement in access to medicines, and we would save a staggering $15 billion per year. Just to put the scale of those potential savings in perspective, $15 billion a year is enough to more than double the number of family doctors working in Canada, paying each of them $300,000 a year. I know you're probably now thinking, how on earth are we overspending by as much as $15 billion every single year? Well, there isn't enough time to go into details on this slide, but I have done several studies on this question, and each of them finds that Canadians spend a lot more on medicines than people in comparator countries because we pay higher prices. We pay higher prices for brand name drugs, and we pay higher prices for generic drugs. It all comes down to bargaining power, the power of price negotiations, and bulk purchasers obtain better prices. And better prices doesn't necessarily mean that you have to risk drug shortages in your country. New Zealand's pharmacare system uses a competitive bidding process for firms to be the sole supplier of generic medicines for up to 3 years in that country. In this system, firms bid on contracts that include a security of supply guarantee that is a powerful tool to be sure that the medicine supply does not run out in New Zealand. If a generic manufacturer is unable to meet the needs of New Zealand at any particular point during their sole supply contract, that manufacturer must pay for the cost of its competitor's product, which could be the brand name drug priced 50 times higher than theirs. Bear that in mind when you look at these generic prices for Canada, where we do not require firms to guarantee the supply we need, versus the prices in New Zealand, where they do require firms to guarantee supply. I have put just 2 examples on this slide to illustrate how much lower generic prices can be if you require firms to compete on price, which Canada does not do. That's probably enough on costs of the systems, which boils down to your system's capacity to negotiate prices on behalf of the population as a whole. Let's move on to financing equity. This slide shows the average per capita expenditure on prescription drugs that is financed directly by individual households or individual employers. It makes it clear that universal public pharmacare systems in comparator countries keep the direct costs to households and the premium costs to employers down. Yes, businesses and households in these countries pay taxes, but their pharmacare systems provide far better access to medicines at far lower total costs and through mechanisms that ensure that no household is put at financial risk because of the health needs of its members, and no business is put at financial risk because of the health needs of its employees. Canada's patchwork system of private and public drug plans, on the other hand, results in massive direct costs to both patients and employers. Those payments made by Canadian patients and employers are not free money to our system. On the contrary, they represent a considerable burden on households and a rapidly growing cost of doing business in Canada. The strains on families are real. In 2016, nearly 750,000 Canadians reduced their household budget for food in order to afford the out-of-pocket costs of medicines that they were prescribed. Let that sink in. Nobody in Canada should be contemplating whether to pay rent, put food on the table, or fill the prescriptions that they or their family members need. Nobody. Businesses and unions are also feeling the pressures and being forced to consider unacceptable trade-offs, such as between jobs, wages, and the company health plan. The right side of this slide illustrates recent trends in the total amount of money that Canadians have spent on prescription drugs priced at over $10,000 per patient per year. Since 2006, the number of prescription drugs that are priced at more than $10,000 per patient per year has gone from 40 to 162. We now spend $7 billion a year on these incredibly high-priced drugs in Canada. Although only about 1 in 100 beneficiaries require such high-priced medicines, those beneficiaries account for 1/3 of private drug plan costs in Canada. If we continue to rely on work-related drug plans for prescription drug coverage in Canada, Canadian employers will have to bear the ever-increasing risk that just 1 or 2 employees could end up bankrupting the company health plan. So is all of this money we're spending in Canada and all of the strains that we're putting Canadian households and business under somehow paying off in terms of pharmaceutical industry investment? No, not even a bit. Here is the percentage of revenues that pharmaceutical manufacturers reinvest in local R&D among countries for which data is available. There isn't much data here, but it tells a clear story. Canada lags behind comparators in terms of pharmaceutical R&D investments, including comparators with universal public pharmacare systems that pay far lower prices for medicines. So, to sum up, our patchwork system of private and public drug plans provides worse access to medicines at higher overall costs to the economy, with greater risks to employers and households, all to attract far less industry investment than universal public pharmacare systems do. This is the point in my talks where I need to take a breath and perhaps a drink. But have another look at this slide. All of this data in every one of these comparator countries proves that Canada can have a pharmacare system that provides better access to medicines at lower overall cost to the economy while better protecting employers and households from financial risks, all without compromising our current levels of industry investment. So, in the midst of a global pandemic and economic crisis, I'm sure you are probably asking, why now? The short answer, the right answer, is that it is the right thing to do. We have a moral obligation to act. Governments in Canada at the federal and provincial level can no longer play the game of pretending there isn't a problem. Canadians are literally dying from inequities in access to necessary medicines. Families are going without food to pay for necessary medicines. Unions and employees are giving up other health benefits to pay for medicines. And all of this is happening unnecessarily because it is costing us billions more than a universal pharmacare program would cost. And among the many things that 2020 has taught Canadians is that our public healthcare system is always there for us when we need it. And unfortunately, that our work-related benefits might not be. Millions of Canadians have lost their jobs during this COVID recession. And with those jobs, they've also lost the privilege of having prescription drug coverage. And now is no time for Canadians to be skipping prescriptions because they cannot afford them. This is precisely when we should be doing everything we can to be keeping Canadians healthy and therefore safe and out of our hospitals during this crisis. Looking beyond COVID, there is no question that things in the pharmaceutical sector are going to get worse for payers of medicines before they get better. An uncoordinated, inequitable, and inefficient patchwork of drug plans is no way for a nation to address the challenges that the modern pharmaceutical is placing upon countries everywhere in the world. The bigger these pressures are, the greater the case for universal, comprehensive public pharmacare. And finally, every credible study on the cost of a universal comprehensive pharmacare program for Canada, including recent studies by Canada's Parliamentary Budget Officer and Canada's Department of Finance, has found that a system of universal public drug coverage for Canadians will save billions of dollars more than it will cost government to run. So when planning a post-pandemic recovery for Canada, the choice isn't pharmacare or another program, such as improvements in long-term care. The choice is pharmacare and other programs, because pharmacare will literally save the money needed to do those other things. So I hope you'll agree. Universal pharmacare is an idea for which the time has come. It has taken 60 years, but its time has come. The vast majority of Canadians strongly support the principle of adding medicines to Canadian Medicare. And unlike any other time during which pharmacare has been recommended by experts, there are now countless groups actively campaigning for universal pharmacare. They represent health professionals, unions, employers, patients, retirees, and more. The research has been done. My job has been done. Indeed, universal pharmacare has been studied to death. It works. It saves lives. It saves money. And it ensures that no family and no business has to bear financial hardships because of medical needs for effective treatments. It is just like Medicare. And just like Medicare, it's going to take a fight to get it. So let me ask you to engage with your profession, your union, and your community to take part in the fight for pharmacare. Talk to people. Share what you know. If you are so inclined, sign petitions, write letters, join marches. Just don't be silent. Windows of opportunity for this scale of radical positive change in our healthcare system are rare, maybe once in a lifetime. So let's make this happen. We can do it. You can help. Thank you.